Welcome to my in-depth guide on deciding if a career in medical coding is right for you. If you've ever wondered how healthcare providers accurately bill and record healthcare encounters, medical coding is the key. It involves converting medical procedures, diagnoses, services, drugs into uniform code sets. If you're new here, I'm Victoria Mull. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. So let's start out by talking more about what is medical coding. So medical coding is taking all of those health records, reviewing them, abstracting all of those diagnoses, procedures, services, drugs, and converting them into uniform code sets. There's different code sets that you use depending on the type of medical coding that you're doing. So we have ICD-10-CM, that is the International Classification of Diseases, 10th revision clinical modification, and that's for coding diseases and things like reasons for encounters. We also have ICD-10-PCS. PCS is the procedural coding service, and that's for coding procedures that are performed in the inpatient hospital setting for reimbursement for those facility fees. CPT is the current procedural terminology, and that is coding for procedures for physician-based services. And then Healthcare Common Procedural Coding System is the lesser used, but for things like services, medical equipment, and other codes that aren't covered in CPT, or if insurance wants a very specific code for their insurance usage versus what's in CPT. So this helps standardize things and helps us track things like disease outbreaks, disease spread, what services are and are not reducing some of those diseases or exacerbating them. And of course, primarily people think a lot about billing. Of course, when we are having these services rendered, we have to generate a bill and make sure that providers are getting paid appropriately for the services that they're providing. But they're also used a lot in things like data analysis, healthcare research, and tracking trends and outcomes. So it really is a key piece in our healthcare field. Now, as far as a career in medical billing and coding, you need some kind of education. Now, medical coding is not regulated in the way that some in other industries are, like nursing. So there's not any kind of governmental or state oversight. Essentially, most employers will hire you if you have a coding certification. Now, it might look better if you went through a formal training program instead of maybe just a self-study or through some kind of like fly-by-night boot camp. If you get official training from like the AAPC or an approved vendor or a community college or a technical school, that might bode a little bit better, especially depending on the support services that they include in their training. If you want to get a degree, you can get an associate's degree in things like billing and coding or health information management, but it really isn't necessary. If you're interested in finding out about the program that I recommend, you can head over to my free masterclass at medicalcodingmasterclass.com, and this free career masterclass will give you the entire blueprint of everything you need to know about a career in medical billing and coding and tell you about the program that I recommend, which is called Preppy. I recommend Preppy because it's online, it's at your own pace, it's affordable, you don't need to go into student loan debt, and they include a lot of amazing benefits, and their customer service is like phenomenal. Definitely check it out. I will link it in the video description below as well, but it's medicalcodingmasterclass.com. Now, as far as certifications, the main contenders out there are AAPC and AHIMA. We have other certifying bodies and companies out there, but as far as if you want to be employable as a medical coder, you're going to need a certification through AAPC or AHIMA. Certifications that are on the top tier would be like the CPC from the AAPC or the CCS from AHIMA. That's kind of like your ticket into the field. It shows that you've passed that first level of competency. And medical coding is something where you constantly have opportunities to learn and grow and specialize. So there's a lot of different certifications out there in different specialty categories and different types of medical coding. You can get certifications through both AAPC and AHIMA if you want. There's just some considerations there because you have to get continuing education credits, which means you have to submit them then to two different organizations. Now, as far as what kind of skills make you good for a career in medical coding, you have to have a lot of analytical skills. You have to have a good attention to detail because small mistakes in this field, since healthcare services are so expensive, can result in big financial impacts. You do also have to have an understanding of medical terminology and anatomy. You don't have to have clinical knowledge as far as being able to perform clinical procedures, but you have to have knowledge about them. You also need to have confidence in your computer skills and your ability to do things like use Word, Excel, Outlook, and you're also going to have to master some electronic medical record systems once you get into the field. Now, because a lot of them are different depending on the organization and they're not software that's like readily accessible like Word or Excel, you can't prepare for that ahead of time. It's something you have to learn on the job. Now, some of the personality traits that might make you more suited for medical coding are if you are a good problem solver, you're very meticulous, you like to research things, and also if you like to read. Medical coding involves a lot of reading and analyzing medical records, looking at lab results, looking at pathology results, procedures, medication lists, and comparing them to diagnoses, all kinds of different things depending on the type of coding that you're doing. And with advancements, we do have a lot of technology that will help pinpoint things now, that'll kind of read through the report maybe and say, okay, look at this, and could it be this code? That is coming up. There's still a lot of reading through and analyzing. If we were to just kind of submit everything automatically, it would be kind of like when you go through TSA and they scan your bags. Imagine if we just rejected or accepted them based off of that scan, and you wound up maybe getting your bags rejected because you had a sack of M&Ms and they thought it was a sack of pills. So there's still a lot of human interaction that is involved in medical coding, regardless of the amount of technology that you may or may not be using. And honestly, healthcare is usually super slow at adopting technology. You also have to be comfortable with repetitive tasks. So it is productivity based, it is accuracy based. So it's a lot of just, let's say you're a surgical coder for OBGYN, you're going to be getting OBGYN surgical reports over and over and over and over and over, and you'll get familiar with them and pump them out. But the great thing about medical coding is there's so many different specialties that if you get bored with that, you can go and see if maybe if you're in a large organization, they have somewhere else you can cross-train in or move over to. So there's a lot of different opportunities if you get bored. Now, as far as work environment, one of the reasons that people love looking into medical coding is because we have a very large remote workforce. A very high percentage of medical coders, over half, are working from home, and a good chunk of them are working in a hybrid situation as well. So sometimes home, sometimes in the office. Some of those offices truly are office buildings. Some of them are at hospitals or healthcare facilities, but there's lots of different work environments for different personalities. So if you want to go into the office, you can certainly find those types of positions. And if you want to work remotely and you are successful at working remotely, there are a lot of those opportunities as well. Now, we do have to remember though that medical coding, because it is accuracy and productivity based, it's hard to do when you're managing other people. If you're taking care of elderly family members or your kids, that's something that they usually don't permit at the employer level because it's very difficult to be successful at both of those things at the same time. Some employers are flexible, but they can be very difficult to find, especially if you're looking for that first job and you're trying to figure all this out in the first place. Narrowing your field to companies that are going to allow you to watch your kids at the same time you're working, it's going to be like a needle in a haystack. Now, as far as the market and the demand for medical coders, the demand for medical coders is out there. You can search on Indeed.com and all these different platforms, and they are looking for medical coders. I will be very forthright though with you and tell you that a lot of the positions that you're going to see out there do want some level of experience, usually 2 years, which is why I recommend programs like Preppy, because they give you an internship so that you get some sort of experience that you can put on your resume. Remember I talked about how medical coding isn't regulated. It's not like nursing where you go out and you do all of these different practical applications. You have time working in the hospital. You can prove that you know how to do things. Because medical coding is just really like you can pass a test and become certified as a medical coder, employers are a little bit more cautious. So you have to keep a very strong job search strategy throughout your entire process of your career. And there's quite a bit of growth projected in medical coding. 8%-ish over the next 10-ish years is projected to grow in medical coding. Again, despite all of these advancements that we're having in things like artificial intelligence, we've actually had a lot of things that have assisted in that kind of similar fashion in medical coding for years. And the cool thing about medical coding is there is a lot of career advancement. So if you find out that you don't like coding and you want to go into billing, you can switch over to billing. If you want to do auditing, that's a possibility. You can move into compliance, you can move into project management, you can move into working with programming the electronic medical records, programming the automated technologies. You can move into senior coder roles, coding management roles. There's a lot of different things you can do. Now let's talk about rewards and challenges in medical coding. So one of the challenges in medical coding is that you have to keep up to date all the time. Healthcare is evolving. It's constantly growing. There's new technologies. There's new different variants of diseases that we get. We have to update those. We need better record tracking, so we have to develop more nuanced coding to track the level of diseases or procedures that we want. There's insurance changes. There's coverage changes. So every year codes change. We have to stay up to date on code changes. There's policy changes. There's just a lot going on in medical coding. And there can be tight deadlines. We talked about accuracy, productivity. There's also a big push to get everything done by the end of the month. It's kind of like bookkeeping, where you want all of the records done by the end of the month to kind of close the books. However, there's some good rewards. Medical coding, once you've been in it for a couple of years, you can get some really good salaries, especially if you move into specialties like interventional radiology, which are really difficult, or if you want to move into auditing. There's really good job stability. There's a lot of opportunities out there. And of course, a lot of remote work opportunities. Plus, it's nice to be able to contribute in some way to patient care by at least reducing their stress from getting inappropriate bills. And sometimes medical coding can take you some places that you don't expect. I know a lot of people have gotten tapped on the shoulder by the AAPC and wound up working on some really, really cool projects. I personally, when I got into medical coding, wanted to work from home. Like, that was my appeal. I'm like, I don't like people. I don't like interacting with people. I don't want to talk to anyone. I want everyone to leave me alone. And then I got into an office and kind of liked collaborating with people. I wound up finding a niche in education and then in content creation, and I've really enjoyed it, and it's taken me a lot of different ways. I mean, in my time, I started out doing charge entry. I went to the AR department. Then I got my job as a medical coder. I went from medical coder to senior medical coder to supervisor of medical coder to medical coding auditor educator. So I've done a lot of different aspects in the medical coding field. And I did it because I wanted something specialized, something where I could do kind of office work, but also in healthcare, which was very stable. And it really has changed my life. So if you're someone who likes kind of working behind the scenes in healthcare, you like medical dramas, you like reading, you're analytical, you're meticulous, and you want to stay up to date, you like a challenge, medical coding could be a really great career for you. But it's really important to evaluate your personal skills. If you're not someone who's maybe going to be comfortable working in medical records or reading a lot or having those tight deadlines, it might not be a right fit for you. And that's fine. I'm not here to push you into a field that's not going to be a good fit for you. And if it's not a good fit for you, I hope you find something that is. So what do you think? Is medical coding the right career choice for you? Definitely let me know in the comments below. Don't forget to like, share, and subscribe. And if you want to know more about a career in medical coding, don't forget to check out medicalcodingmasterclass.com. Or you can watch this entire playlist that I have of videos to tell if medical coding is the right choice for you. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.